And we are back. As families get back into the swing of the full school year, we want to ensure that kids start off the year right. Well, for many children, the return to school could actually trigger some feelings of anxiety and stress, making this an especially tough time of year right now in the winter. Joining me now to share a little bit more, shedding light on the mental health challenges faced by youth in our community, as well as providing some tips for advice for families. We've got the program coordinator with the Children's Mobile Crisis Team at VNS Health, Joheily Gonzalez, and thank you so much for being with us.
Thank you for having me.
Talk to me a little bit about that, because when we talk about this time of year, winter time, we've got a lot of young people who are really going through this whole crisis of mental health, but sometimes undiagnosed, and sometimes we as a wider community don't even know about it.
Yes, we've been seeing an increase in children experiencing mental health crisis, which has been heightened due to the pandemic. And most of the time, parents, they don't know what access and services they have, and they know very little of the resources offered to them that can be of support to them. And, for children returning to school, and these transitions can cause a lot of anxiety and stress and fears. And in the mobile crisis team, we see a lot of that. And our main goal is to help manage the children and parents navigate through all of that. And sometimes it could be due to multiple reasons. It could be lack of structure in the home, in a school environment, among a number of other things.
So a person on the outside may not be able to necessarily see somebody struggling in the area of mental health, but you and your team are very well trained. Talk to us about what are some of the signs that maybe we should be paying attention to if we see kids begin to waver and do things throughout the school year.
Yeah, signs of a child being in a mental health crisis can often be exhibited in physical situations where they may be experiencing headaches or stomach aches, and they may be overeating or oversleeping or not eating or not sleeping at all. Repeating their words a lot, and these are all things that we want to be mindful of. Because it shows that anxiety is rising. These are all signs of anxiety that the children may be dealing and faced with.
So if I have a child that's rising in the area of crisis, and that might be happening in the classroom, might it be happening at home, what should I do?
Yeah, the first step is to be aware. Be aware, be curious, and ask questions. I think it's really important for teachers and parents to establish an open relationship with children where they're able to communicate about how their day was, what they're feeling, what's going on. Because oftentimes, parents are the last person to find out the challenges that their children are faced with every day at school. And teachers spend a lot of time with the students at the school. So they're able to observe when the children are engaging in acting out behavior, or they may be withdrawn for a particular day. This is when it's really important for the teacher to pull them out and ask questions. I see that you're not being yourself today. What's going on? And then explore a plan to put in place to support them. But it all starts with parents communicating and validating to the youth, it's okay to feel these ways, and we're going to help you through it. You're not alone. This way they can feel comfortable, and their self-esteem about this can be a little bit more normalized. Right. Many of the youth, live in different situations, unstable homes, and just, living in a small home unit with multiple generations in there as well, which may have some stigma around mental health and this being not normal, or this is okay, he'll get through it. But it's really important to challenge this idea, explore more, because there could be a number of signs. Children engaging in self-harming behaviors, experiencing suicidal ideations, which sometimes can be attention-seeking, but other times are not. And it's really important to investigate and be proactive when we're seeing these signs manifest.
Is there a particular time of year that we really need to be also zoning in? Because, we're coming out of the holidays, the second half of the school year. Are there some hot spots that, parents and those of us who are in the community can be paying attention to?
Absolutely. That's a great question. Typically, before the holidays are really tough for children. For children and families, they struggle with the holidays coming in, and the idea that I need to have this and that for my child, and they may not have it, because they're faced with other challenges in life. So it's really important that throughout the holiday, when they're experiencing transitions of starting a new school year, of coming back from a school break, and in the summertime, to always be vigilant with what's going on, and have open conversations, engaging in self-aware. Building that relationship is really important.
Take me behind the scenes a little bit for a crisis team. An incident occurs. How do you roll out?
Yes, so we receive all of our referrals from NYC Well, and once we get the cases, we have 1 hour to 2 hours to respond. We're a team of two, a psychiatric social worker and a family advocate, go on to the case, and we cover the entire Bronx. So at any given point, we can be anywhere here in the Bronx. And we service children from the ages of 6 to 20 who are experiencing severe crisis. The services that we provide are very important and very unique because we meet them at their home, the most intimate space for them. And in doing so, we're able to see the family dynamics and see other views that are happening in the home to provide support. Our approach is one of being here to support, and it's going to be okay, and we're going to get through it. So when the team goes out, each worker, clinician has a different goal. The psychiatric social worker's goal is to meet with the youth, to assess the situation, come up with a safety plan. Hey, we were called by your school. It seems like you're engaging in self-harm. Talk to me a little bit about what's going on. And most of the time, we're the first ones to find out about these situations, that the child may be experiencing bullying or engaging in self-harm. And, it is our duty and responsibility to psychoeducate the parents of our findings and put services of support in place. And our main goal is to assess for safety and safety plan. And most of the time, there are many youth that are not able to keep safe. They're not able to secure a safety plan and coping strategies. And that would definitely does warrant for a higher level of care, such as hospitalization. So when we consider hospitalization, this being the most appropriate step for the safety of the child, we assure the family that they're not alone. That, this can be a very scary situation for the children to go into the hospital, for EMS to be activated, especially now because the police also shows up.
Right.
But we let them know we're not alone and we're going to be with you every step of the way to support and advocate for you. And this is okay, and this is temporarily. And we're there from leaving their home unit to going with them to the hospital, to the emergency room, advocating and make sure that they're in the great hands, And our services, we meet them anywhere, in the school, in the home, in the runaway shelters, outside, the parks. We meet them wherever they're at.
Total wraparound. Mm-hmm. All righty, Joheily, we're going to leave it there. Thank you so much for being with us.
Thank you so much.
All righty. Now,
Happy
I
to
want
be
to know if you want more information, don't hesitate. Visit the website, vnshealth.org, and then also call 988 to access mobile crisis support. We encourage you don't go anywhere. We got more open coming up right after this.